From the News Channel 5 Network, this is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Beres here on a Tuesday. How are you? Well, I'll tell you how you are. You're doing great because you're joining us on the show. We're going to open up the phone lines in a moment. As I said earlier this week, promoting this, I always like to give you a heads up so you can prepare. If you have a question, we're talking Social Security this morning. It's our monthly show where we take your phone calls. We can talk about everything from SSI, disability, the application process right now. Where are you? Do you need a lawyer to help go through this? Any other questions you have, maybe as we embark upon the new year, and we'll discuss the possibility of other changes, even though I don't think there are any big ones, but I wouldn't be the one to ask. The person to ask would be James Shanks from Social Security. Good morning, sir. It's nice to have you on.
Thank you.
Well, we're going to open up the lines. The number's up there, 737-7587. You know the show gets busier as the minutes pass. By 8:30 or so, it gets even fuller. So jump in if you want, but let me hit you first before we get into all that with one. Are there any changes? Is there anything we need to hit on, maybe since we last talked? I doubt it, but anything people need to think about as we approach the new year?
I'll say no major changes.
Okay.
Not right now, but I do want to say that it's Christmas time. 'Tis the season. Social Security will be open every day other than Christmas Day and the day after Christmas. The President signed an executive order last week giving us the Friday after Christmas off work for all federal employees. Now, after Christmas, the week after Christmas is traditionally very, very busy at Social Security.
Really?
We are
the week
open
between Christmas and New Year's?
We are open normal hours. However, know that most of the staff likes to take leave that period. A lot of people are with their families.
Their vacation that they take.
So the wait times and everything can be extended. So
is that why it's busy? Because there's shorter staff, or are there more people, coming into the office or making calls just during that week for some reason?
Well, it's the new year. Traditionally, people retire at the beginning of a year. Kids are going back to school. Need Social Security cards, things that it's just like the perfect storm, Nick. It's the perfect storm of Social Security.
Right. All at once coming, along with, so all those needs that come up along with a shorter staff.
Plus, it's
staff.
Christmas time. There's Christmas presents, which take money. If you missed your check, you're really going to be wanting to get in there to try to see Social Security. And like I said, in emergencies or even in normal circumstances, it's fine. We're open to the public, but just know that the waits will be extended.
Okay, and when you talk about someone missing a check, what are the reasons that might happen? I mean, aside from maybe just something, maybe a clerical error that can be corrected, why will a check maybe not arrive?
I'd say the most frequent reason checks aren't deposited on time.
That's right. And by the way, they're not mailed anymore. They're direct deposit. Yeah.
Is if you don't have direct deposit, even though we have encouraged you strongly to get that, and you've missed a check literally because it got lost in the mail. Or often it's based on reporting issues. You switched addresses, you didn't let us know. You worked, you didn't let us know.
Okay.
Things of that nature will cause your checks to be delayed.
All right, good. That's one thing we can touch on. Again, as always, the general questions, we'll probably get some today. If you have folks wondering about the process, we're maybe going to get some calls as the new year approaches. People say, gosh, I can remember I was in this same situation last year waiting to hear from Social Security on whether or not I would get my benefit, and I'm still waiting. What's the process? So real quickly, before we get to the lines, and they are open now if you want to jump in. If you apply for, say, Social Security disability, from the point when you apply, how long typically should the process be before you know whether you're going to get it or not? What does it take? How long a time? Provided you're not one of those folks that are terminal. But in general, what are we talking, 6 months to a year?
If you file a claim and you're at the initial level, you can expect a response from Social Security within 3 to 4 months.
Okay, and that's the first step.
That's
meaning
the
that
first
if you
step.
get rejected, then you appeal and all that, right?
If you're not approved, you'll file an appeal. Once you file your appeal, you can typically expect to hear back from Social Security within 2 to 3 months. So at this point, you're around the 7-month mark. Now, that's assuming you have filed all your appeals timely. You have 60 days between steps to file your appeals. There's no reason to take those 60 days because you're just delaying your benefits further. But you do have it in case something comes up. And people do get hospitalized or have car wrecks, things of that nature. So you've got 60 days to file your appeals, but if you do everything extremely timely, you'll be sitting filing for a hearing before an administrative law judge around the 7th or 8th month mark from the time you start the process. Now, getting your hearing scheduled can take anywhere from 6 months to a year. Then you'll see a judge. So depending on the hearings workloads, you're looking at between a year, year and a half to getting before a judge and having a decision made if you go that far.
Yeah, if it keeps going, if you've been denied.
Now,
up
after
to
the
that
judge,
point.
there's also another level. You can go to the appeals council if you do not agree with the judge's decision. Again,
So people can be battling this if they keep getting denied, for months on end.
That's
If
correct.
everything goes smoothly, the fastest you can be approved, short of someone who's terminal, would be what's the fastest you've ever seen someone from the point where they applied, where they clearly, again, not the terminal patients, but a disabled patient. How long?
well, we have two different criteria. There are terminal cases, and there's also cases that meet what we call presumptive disability. A good example of that would be Lou Gehrig's disease,
Okay.
ALS, something like that.
Sure.
But short of those cases, just a regular kind of disability, my back's hurt
Yeah.
type of deal, it's going to take the 3 to 4 months.
3 to 4 months is what that plays into. Real quick, too, you had come on, I think, probably a month and a half ago to talk about the fact that there was a cost of living increase. Have people already seen that in their checks, or when does that kick in?
Should be on the January check.
The January check's when it starts. And again, it was a small amount. You may have to look twice to see that you got it, but you are getting, what was it,
1.7.
1.7% cost of living increase, better than nothing. But again, you're going to have to look closely to see if it's actually on there. But they did give you an increase starting in January. All right. Lines open, 737-7587. Before we take our first break, James, let's take some calls. We'll go to Betty. Betty, good morning.
Good morning.
Hi, Betty. How can we help you?
I want to know what's the least amount on a Social Security check you can draw before you can draw a SSI check.
All right, that's a good question.
Okay. All right.
So she's alluding to, and something that we try to mention quite often, there's two different disability programs.
Right.
There's a regular disability program where you've worked and paid in, and then there's the SSI program, which is based on general tax dollars. SSI, the most that they pay in 2014 was $721. Okay. So
A month.
a month. If you're drawing a disability check that's $721 or more, you won't be doing the SSI. It's not an exact science. It depends on your work. It depends on access to income and resources and things like that. But just as a general rule, I would safely say somewhere in the $650 range to $700 range. If you're drawing that from another check, you're not going to be eligible for SSI. Okay, but again, when you're dealing with the SSI program, you can never put definites on anything because work, income and resources, like-kind support, a lot of things factor into that. But that's generally how the rules will work. Now, as an example, if you're drawing $300 from regular disability, you're due $421 from SSI. Okay. Now, if you're regular disability, you get a cost of living increase and it goes up $30. Well, your SSI check will come down $30.
Makes sense.
Okay, so while you're drawing SSI, you're never going to be over that 721, what they call the federal maximum rate. You're never going to go over that between the two programs.
Does that help you, Betty?
Yes, sir. Thank you.
You betcha. Thank you for your call. Again, that's not a lot of money in the sense of some people may be having to live on that month to month.
Often, especially when we talk about the SSI program, it's not the money that you're after. It's the access to TennCare. Once you get on SSI, you have access to the Medicaid program.
Yeah.
That can help you tremendously with health expenses.
Good point. Let's go to Joe. Joe, good morning.
Good morning, Nick.
Hey, Joe.
Just a couple of comments.
Sure.
I had occasion here, this has been a while back, to ask a question about what I needed to do on changing some stuff on my Social Security. I tried to call the phone number starting at 9 o'clock in the morning all day long, and all I got was a busy signal. Never was able to talk to anybody. Finally just had to go down there and take my chances. But I'd like for them to address that, why nobody never answers the phone. And the second thing I would say for all these people that's filing disability claims, I know Mr. Shanks can't address this, but I'll give them a clue that when they go to file for Social Security disability, they need to get them an attorney because it's so complicated and there's so much paperwork involved. You need some direction. If you try to do it yourself, you're fighting an uphill battle.
Interesting. I mean, and I can see how some people might feel that way. You want to take those two?
Sure. And
calls?
I mean, as far as the phone calls are concerned, I agree, and I know. Social Security has set up a system because the call volumes became so tremendous where phone calls now roll over from office to office to office to office. Often, a lot of phone calls that you have called Metro Center will be answered by Oak Ridge or another office in the state.
Interesting.
Eventually, they will roll out this program so all offices in the country can help each other with call volumes. Unfortunately, and if just for full disclosure here, I will tell you, we have about 4 people on the phone a day in the Metro Nashville office. Metro Nashville serves 60 to 70,000 recipients, maybe more. So we have 4 people answering those calls.
I mean, it's just crazy. Is that a budget thing? Because that really sounds, frankly, absurd.
It's a staffing issue.
I know.
As you take people off, put them on the phones, that means the lobby, kind of the wait times out there balloon even more. So
yeah, I understand.
They're always trying to, it's a delicate balance. And then also with our 1-800 number. Now you can make changes with the 1-800 number as well. 1-800-772-1213. Versus calling your local office.
Let me get on my soapbox real quick before you go to the question about the lawyer, and then we're going to have to take a break here. But and I may have you answer that when we come back from the break. But my soapbox is this: be it Social Security at the federal level, or be it the DMV locally here, when you have to go and wait through these monstrous lines to get your new driver's tag. People don't want to pay for services. Everyone complains. You all complain about paying taxes. You want lower taxes. And I know some of your tax dollars are spent wastefully. I have no doubt about it. But when you continue to no taxes, I don't want to pay, and then you get put on hold when you call Social Security because they can only afford to hire 4 people to handle 60,000 people that may have Social Security calls, or you're waiting in a huge line because they can't afford more people at the DMV. You can't have it both ways. Maybe I'm oversimplifying it, but my point is, yes, we don't like taxes, we don't like to pay for it, but we all want services. Doesn't work that way. Think about it. We'll take a break. We'll be back with more of your calls right after this.